would like to really thank the organizers for the invitation for me to come and share our experience in respect of dengue fever. As you probably know, 2024 has been the worst year for dengue cases on record, and there has been over 10 cases that have been from all across WHO regions and report from 176 cases, with really quite a significant number of deaths. Now, why am I coming to talk about dengue, in the context? Because this is actually one of the neglected tropical diseases now notified by WHO. So 10 million cases, over half of them are laboratory confirmed, 6,500 deaths. And you can see from this map here, where are the countries that transmission have occurred, and particularly when you talk about 3 viruses here, which WHO have identified, you are talking about not just dengue, you're talking about chikungunya and Zika viruses as well. So, and more importantly, I just want to highlight, in the context that everyone thought that dengue was going to be a tropical illness, that it doesn't affect some of the European or UK countries. But if you look, at this map here, there has in France, Italy, and Spain. So dengue is not a tropical illness anymore. It obviously have got a number of these illnesses that has been imported, particularly by travelers that has been to that part of the world. Now, if you look at United Kingdom has had surveillance on dengue cases for quite a number of years. So 2023 was in fact the most alarming year of over 904 cases, and you can see that the age group here are mainly among people from about 20 onwards to about 60 years of age, in that context. So I think it's not just a tropical illness anymore that we should be aware of. It is actually an illness that an infection imported from abroad that one can actually be considering in that respect of very, very hardly focus on. Right, so I am based at University of Newcastle in United Kingdom, but have been seconded to our Malaysian campus. We have got a big campus in Johor Bahru, and this is where my experience and some of my research work on dengue has been focused. And Malaysia is one of the hot spots for dengue. 2023, if you look, there's over 123,000 cases, in 2023. And at that period of time, there were over 100 deaths. And these are all confirmed cases using NS1 antigen, immunology and PCR tests, because it is mandatory for those to be positive to be registered and notified to the Malaysian Ministry of Health. So let's look at some of these figures here. Obviously, 2023 very troubling year of nearly 100 deaths, population, and about 3/4 of these individuals have comorbidity. A lot of work and education has been done to the public and to healthcare professionals, and fortunately in 2024 there has been a number of significant reduction, down to 24 deaths, about 23 deaths and 1 pediatric population. And again, about nearly half have comorbidity. And unfortunately, health promotion and health literacy is still rather lacking, because a number of these people are seeking treatment, unfortunately, rather late in that context. So delayed in diagnosis and underestimate severity from the healthcare point of view. And I think that's what a lot of interest that has been done has been actually focused, particularly over the past 5 to 10 years, on dengue cases in the world as a whole. And I do not think that dengue should now be regarded as a neglected tropical illness. It should really be focused on by all healthcare professionals, even in those countries that you don't think you are likely going to encounter dengue. So what are the demographics of this died in 2023? If you look at it, 50% of the individuals are aged between 40 to 69, and these are the demographic population of those individuals. And I think here you are, there's quite a bit of an answer in that context in terms of the age group that one could actually consider. And yes, the 5 key comorbidities: hypertension, diabetes, ischemic heart disease, morbid obesity, renal failure was identified, but look at the number of cases of people with no known medical illness that unfortunately in 2023 that has succumbed to dengue. And these are the whole bunch of other medical conditions that has been identified to have been associated with their death, in 2023. So what has been the challenges? And that's why I'm here, trying to actually share some of our experiences with you guys. This has been undifferentiated fever to life-threatening shock. Early and accurate diagnosis is a problem. Predicting severity, and obviously patient going to develop organ dysfunction. And the key role in terms of management is because we do not have an effective drug to treat dengue. It has to be a time-sensitive resuscitation. And what has been the challenges? The challenges, and why I mention this talk as being the silent threat, is in terms that 3/4 of the individuals that have dengue are asymptomatic. It's only 1/4 of them that are symptomatic, and out of those symptomatic individuals, about 95 to 95% of them will have their dengue fever symptomology, but 1 to 5% will develop severe dengue. And dengue has got 3 clear clinical phases here: the febrile, critical, and recovery phase. So the history taking is actually of almost importance in terms of, yes, during the first 3 days of the illness, you get your febrile illness. And if you're unfortunate to then develop the severe dengue manifestation, that's when you actually have got some of the manifestation that could be, you may be potentially very sick with symptoms of shock and some bleeding diseases, which I will highlight to you. And if you are lucky and had good time-sensitive resuscitation, you may recover, in that context. So the clinical illness during the first phase of being febrile is dehydration, your organ impairment with either shock, bleeding, diseases. And when you recover, there's still quite a big of a challenge when you actually have got your fluid that is being reabsorbed from the extracellular space into the intracellular space. And laboratory changes do show us key to how you actually manage to actually clinically treat your patient in that context. The hematocrit is a very important aspect of your monitoring in terms of seeing whether you are going to be heme concentrated or you're going to be heme diluted, which means that the fluid has been actually going from the extracellular space to the intracellular space. Your platelets is likely going to drop during your critical phase, and it just shows some recovery. So therefore, close monitoring of those indices are very, very important. And obviously the main key of diagnosis is obviously identifying the virus, the PCR test, but obviously the PCR test is not widely available. The NS1 antigen test is widely available, and I'll demonstrate some of this to you later on. And the immunology, the IgM and IgG measurement is also important in that respect. Right. So this is the algorithm. Okay, this is the guideline that has been practiced in our unit for quite a period of time. Okay, so early phase NS1 antigen PCR, if obviously, in the major hospital, they are widely available and they are positive, you confirm acute infection, then you actually continue to actually manage the patient. The transition phase, okay, yes, you use the NS1 antigen, I mean IgM, IgA, maybe IgG may be positive, but it does actually give you some indication that if you are IgG positive, it simply means that you had previous dengue before, because most of the complication that you get from dengue is actually from your second or third or fourth episode. And that has been the traditional teaching, but I'll show you what we have found recently in our study. So this is the N1 with the IgG test kit within 20 minutes, okay, of using a spot. Very much like the hepatitis C and hepatitis B, okay, because it's actual fact the point of care testing kit from HIV and COVID-19 is actually borrowed from the technology of dengue. So this has been around for quite a period of time. So you can actually get a result pretty quickly at the bedside. So WHO have had a new dengue classification of warning signs and severe dengue. Okay, with or without warning signs. And the severe dengue is when you manifest a severe plasma leakage, severe hemorrhage, and severe organ impairment. Okay, so what are the warning signs? Any abdominal pain, tenderness, persistent vomiting, diarrhea, third space accumulation, that means fluid going into the wrong compartment, spontaneous bleeding, lethargy, tender liver, okay, and rest hematocrit, which is very, very important, okay, in the context of you monitoring your patient. In that context, we even have got a mean value for our own local Malaysian population. So there has been quite a number of systemic review looking at all the markers where you can see whether you can actually predict severe dengue. And some of the studies have shown if you are a child, if you have had secondary infection, i.e. either your second, third, or fourth infection, pre-existing diabetes, renal disease, increased hematocrit, if you got abdominal pain, lethargy, vomiting, enlarged liver, ascites, pleural effusion, and melena. Okay, in that context. But how good are those predictors of all this in terms of at the bedside? So the main issue, okay, in severe dengue is lack of clinical acumen in assessment. Patient can be alert, able to give history, normal blood pressure, but they could well be in compensated shock, okay, fluid in the wrong compartment. The peripheral pulse, okay, heart rate, maybe in concurrent, breathing comfortable, lying supine. They could be in shock, silent tachypnea with metabolic acidosis. Temperatures can be settling, but that could be the start of their leaking phase or disaster in progress. And unfortunately, they may have been triaged in the normal setting that their temperature was actually normal, but they were actually still in the critical phase. What did we do? And there's a lot of data here. I'm going to show you some of the highlight. We undertook a study in January 2022 to March of 2022, okay, looking to see which are the biomarkers that could well give us better assessment. So essentially, we look at people that were admitted to intensive care and people that were not admitted to intensive care. So there were 51, 48, and these are the demographics, okay, of those individuals here. So you can see that the people that got admitted here, there's a slight bias, okay, to intensive care 1 to male, a slight bias for the non-ITU to female. And these are the age group, this is the ethnicity. But if you look at the weight, okay, differences, it is actually quite remarkably different, okay, in the context, and then the comorbidities as well. And here, I just want to show you again, I know there's a lot of data here, but I just want to actually highlight some of these aspects to you in terms of, yes, The people that are ended up in intensive care are anemic with a low hemoglobin. You can see the hematocrit is low as well, okay, and there are some with raised hematocrit, and the platelets as well is actually different in that context. But what I want to actually highlight to you as well in terms of in the context of their other abnormalities, okay, in the context of liver function and their sodium level as well. Okay, the individuals that got admitted to intensive care has got much more lower sodium level. And the liver function tests here are shown, okay, in that context, okay, and you can see that there are quite a amount of differences between the two. And I'm going to just pass all this off because I just want to one other key messages here. One other key messages is that we traditionally think that, yes, it's always been that you had to have dengue before to have complication. But look, at nearly, okay, 30% of those individuals that had no dengue immunology evidence at all, okay, in the context. And similarly, with a number of the non-ITU patients. There are 4 serotypes of dengue, and you could see the one that we have got the most in Malaysia is dengue 2. Okay, so I'm not going to dwell too much on all these other warning signs, but I just want to show you the key findings of this particular study. So if you're age over 50, you are 5 times more likely to be in intensive care. If your weight is greater than 27.6, you are more at high risk. Thrombocytopenia, hypotension, mucosal bleeding, and plasma leakage. Okay, so it's important that this study highlighted the importance of investigating patients presenting with fever, persistent vomiting, diarrhea, abdominal pain, lethargy for dengue. Obviously not very specific to dengue, okay, with a febrile illness. Other markers that one should be highlighting too, okay, and therefore should raise concern about potential progression to severe dengue and the potential for ITU admission. So we are evaluating some of this prognostic value of these laboratory markers and the role in predicting ICU admissions and patients' outcome with the aim of actually developing a comprehensive validated scoring system, like an application that you can actually use at the backside, incorporating both laboratory markers and clinical features. Now, I know it's I spent 19 minutes now talking all this through to you. Let me just quickly, I got a few more slides, but I just want to skip some of this. But I just want to highlight some of the it's called the protocol to actually use. Okay, I'm more happy to share this, okay, to talk this through with you. And that in the context of, yes, again, in the febrile phase, what do you do? In the critical phase, you make sure that you actually correct and replace the fluid loss. And at the recovery phase, it's very important that you do not fluid overload the patient, because you may end up doing more harm than good for some of this individual. Okay, so I'm going to just okay in some slides in terms of, yes, dengue can be another hematological complication, which is the lymphohistiocytosis. We have reported quite a number of cases, and this is also in the literature, okay? And we particularly initially quite puzzled by this, okay, because you can see the patient actually continuing to have fever day 2, day 3, day 4, and they are actually not getting better at all, okay, despite in that context. And then that's where a bone marrow was undertaken, and then it shows that this patient has actually developed HLH, which is really, if you look at the literature, about 12% of severe dengue that develop this complication. And there is fortunately a score that one can actually use to actually calculate its risk, which is the H score, that's showing the probability of the presence of secondary HLH. And we are very fortunate that there is actually a physician in France that has undertaken this particular app, okay, that one can actually use, and very very helpful context. Okay, so management, observation, IV dexamethasone, and some centers have actually used etoposide. There is unfortunately no control trials to actually how to best manage HLH, okay, in the dengue population. Okay, so what I mentioned earlier on about algorithm in developing an app is actually on the go at the moment. There are small studies, and we are collaborating with a number of other colleagues internationally to try to develop this bedside score to develop dengue severity. Very similar to the group that were talking about leptospirosis earlier this morning. So dengue is one of those issues as well. Okay, so effectiveness of a diagnostic algorithm based on neural network AI comes under very much up to it. I must make sure that I thank all my collaborators and the funders of some of the work that we have done, okay, particularly over the past 8 years. Thank you very much for your attention.